Video conferencing is an additional way for healthcare providers and their teams to have consultations with service users. The HSE are now using the video conferencing tool called Attend Anywhere. Attend Anywhere is a simple, safe and secure web-based platform that aims to mimic what happens in the real world by continuing to offer pre-arranged appointments, a designated waiting room and consulting room, but just done virtually. Attend Anywhere is currently being rolled out nationally and across Donegal, Sligo, Leitrim, Cavan and Monaghan.
Attend Anywhere has revolutionised the physiotherapy service in County Donegal. It has allowed us to remotely assess, treat and monitor patients with a variety of conditions such as spinal pain, Parkinson's disease and arthritis. We can see, by video call, how our patients are managing their condition at home and how they're getting on with their exercise programme. It is particularly beneficial for patients who have difficulties getting to our clinics because of mobility and transport issues.
Attend Anywhere has been a great resource for the physiotherapy department in Cavan Monaghan. It has allowed us to assess and review patients who otherwise would have had their physiotherapy treatments postponed as a result of the pandemic. Thanks to Attend Anywhere, we have been able to continue their care. In Cavan Monaghan, we have found Attend Anywhere especially useful in the paediatric setting, as it means parents don't have to bring small children into a busy clinic. It's also been really useful for adults with long-term conditions. We can monitor their progress remotely.
From a healthcare provider perspective, it's really simple and straightforward to use. The service provider simply enters Attend Anywhere in the web browser at the top of the screen. It can even be saved into favourites, so it's quick to access each time. The service provider can see their patient's name in the waiting room. They can also see how long they've been waiting. When you find the patient you want to start a call with, simply click on their name, which brings up the options to join call or notify. Notify is really useful as it sends the patient a message. For example, if you're running behind schedule and you just want to let them know.
How are you getting on?
Aye, grand, not a bother.
A link is sent to the patient in advance of their appointment, which they click on to enter a virtual waiting room. If they are a regular patient, then they can save the link so they can access it quickly in future calls. When connected, the patient can talk to their service provider as if they're in the same room. Other options include another family member or member of the multidisciplinary team joining the call if appropriate. And other information specific to the caller's needs can be shared on the screen with the patient. Example, inhaler technique or home exercise programs. This can be used by many other services in a variety of ways.
Attend Anywhere is being successfully adopted in a variety of HSE services across the community. Examples of these are audiology services in Donegal, pain clinic in Sligo, Leitrim and mental health services in Cavan and Monaghan. We have had interest from services such as respiratory, palliative care, mental health, diabetes and dietetics. Video call consulting will be part of how we deliver our health services into the future.
Using Attend Anywhere has exceeded our expectations and the feedback from patients and staff has been very positive.
Attend Anywhere gives us an extra option for patients who have difficulty accessing services.
Patients find it really beneficial because it saves travel time to clinics.
We as physiotherapists in Cavan and Monaghan plan to continue using Attend Anywhere as an additional resource, as well as our usual clinic visits.
Attend Anywhere technology is really easy to use and accessible for all ages.
The appointments are really flexible, it's comfortable to do in your own home, and you feel more comfortable in yourself talking to your physiotherapist because you are in your own home, you're not in a clinical setting, and I've really enjoyed it.